right, broadcast services, we're ready to go when you are.
Thank you, Chair Brooks. You are live to the broadcast and may call the meeting to order whenever you're ready.
All right, we will call this meeting of Senate Finance to order, and we have 6 bills that we'll be hearing, and I'm going to take this, I'll call the roll first, though. Secretary, will you call the roll, please?
Senator Dennis? Here. Senator Kekeffer? Here. Senator Goycochea? Here. Senator Hammond? Here. Senator Ratty? Here. Senator Sievers-Ganzert? Senator Cannizzaro? Senator Dondero? Senator Dondero-Loop? Chair Brooks.
Here, and we'll just mark Senator Dondero-Loop present when she arrives, and Senator Cannizzaro is on the Zoom. So we'll get started. 6 bills, and I'm going to take them out of order. I'm going to take the Department of Education or Education Bill Committee bills first. So that'll be Senate Bill 76, and then we'll do Senate Bill 194, and then we'll move into 70, 154, and 274. No, excuse me. And then we'll move into 40, and then we'll do 70, 154, and 274 last. So we'll start with Senator Lang. Oh, and before we get started, I'm sorry, I did just want to remind folks that this is a Finance Committee meeting on the fiscal impact of your bill and not necessarily on the policy of the bill. The policy was already discussed in the Policy Committee, and so we just want to really get to the fiscal impact and clarify some of those issues. And so starting with Senate Bill 76, Mr. Thorley, if you wanted to introduce the fiscal issue on that bill.
Thank you, Mr. Chair. Senator Lang's bill is Senate Bill 194, if you wanted to do that one first. Okay. Good morning, everybody. Wayne Thorley for the record, LCB Fiscal Analysis Division. Senate Bill 194 was referred to Senate Finance Committee to discuss a handful of fiscal notes that were submitted on the bill as introduced. The Department of Education had a small fiscal note on the bill as introduced. So did the Nevada System of Higher Education. They had submitted a fiscal note indicating that the bill as introduced would have an unknown cost on them. Also, several local school districts also prepared and reported a fiscal impact on the bill as introduced. The Senate did adopt an amendment to Senate Bill 194, Amendment 220, which is on Nellis. So, thank you, Mr. Chair.
Thank you. And Senator Lang, you can come up and
Good morning, Chair Brooks, members of the committee. For the record, I'm Roberta Lang, State Senator from District 7 in Las Vegas. As you know, Senate Bill 194 establishes the State Civics SEAL program. We have worked with the Department of Education and other entities to ensure that the fiscal note on this bill has been reduced. Originally, we had a student community panel that we have now amended out of the bill, and additionally honoring the schools of distinction and kids and teachers is already being done through the excellence program with the Department of Education. So we were able to just use that program and not add something additional on. So I believe that we have been able to reduce the fiscal note significantly, and I hope that meets with the expectations of this committee.
thank you, Senator Lang. And so we have a Department of Education fiscal note. And is it your understanding that the amended version, and this is as introduced, the amended version removes that fiscal note or reduces it significantly?
I'm sorry. Thank you, Chair Brooks, for the question. And Sarah Nick from the Department of Education is here if you'd like her to speak to that as well.
We would, thank you. Ms. Nick?
Good morning, Chair Brooks, Vice Chair Dennis, members of the Senate Committee on Finance. This is Sarah Nick on behalf of the Department of Education. Thank you to Senator Lang for working with us so we were able to reduce the fiscal note. The amended fiscal note is for $4,008. This reduced amount reflects 30 hours of staff time to work in sections 2, 3, and 4 regarding the creation and the maintenance of the state seal for civics. Section 5, the Nevada School of Civics Excellence, an estimated 20 hours. And finally, Section 9, an estimated 20 hours of staff time regarding service learning projects. And this estimation was created using the grade 39, step 7 for EPPs of $38.18 an hour.
Thank you, Ms. Nick. Now, did you submit a revised fiscal note to fiscal staff?
I can formally submit this revised fiscal note, and I provided it in email to Senator Lang.
Thank you. Appreciate it. Does the committee have any questions for Senator Lang or Ms. Nick? Senator Kiefer?
Thank you, Mr. Chairman. Some of the fiscal notes I was looking at were particularly related to the school districts. I know that's not your purview, but for example, Carson City submitted a fiscal note of $750,000, indicating that they would need all new curriculum and materials for all social studies classes to assure that we're inclusive of recognizing all of the groups described in the bill. It's not specific. I assume that they are referring to what's on page 8 of the reprint in section 11, subsection 2. Do you have any comment on that?
Thank you, Senator Kiefer. Chair Brooks, through you to Senator Kiefer. Regarding Section 11, it's my understanding that there's also a similar assembly bill. I want to say Assemblywoman Anderson's Assembly Bill 265 that's 261, I believe is the correct call number, for curriculum diversity. And I believe that the department is working with both Senator Lang as well as Assemblywoman Anderson to do the adoption of any new standards to reflect curriculum diversity on our current cadence so as not to create an additional fiscal burden for, say, districts to immediately adopt or re-implement new standards or curriculum materials, that we would keep our same adoption cycle. And we'll continue to work with Senator Lang, Assemblywoman Anderson, as well as the school districts to make sure that that's streamlined appropriately.
I appreciate that. So would that require, so say the other bill weren't to pass, right, and this one were, would we need some sort of language in here to ensure that that these updates are on the appropriate cadence, if I'm using the correct parlance?
Thank you, Senator Kiefer. Chair Brooks, through you to Senator Kiefer. I will be able to supply Senator Lang the same language I supplied to Assemblywoman Anderson, which reflects that any new standards would be adopted on the department's current standard and curriculum adoption cycle, so as not to create an additional fiscal burden on our school districts.
Much appreciated. Thank you, Mr. Chairman.
Thank you.
Thank you, Senator. And Ms. Nick, is there anything in the bill as amended that you feel would prohibit you from just doing this on the schedule that you have indicated that you want to do anyhow? Or, building upon Senator Kiefer's question, is it necessary to have that language in this bill, or is there anything in this bill that directs you to do it in a time frame that you would find didn't meet with your the cadence that you were going to do it on?
Thank you, Chair Brooks. Sarah Nick, for the record, on behalf of the Department of Education. After our staff's lengthy review, and thank you again to Senator Lang for working with us on this bill, our staff have not flagged anything that shows that language in this bill would create more friction or delay the timeline for implementation. And for the record, the department is already working with all of our school districts and the Charter Authority already on diverse curriculum.
Thank you. And Senator Kiefer, you said you saw a Carson City School District fiscal. I don't see that listed as one of the fiscal notes on this bill.
Yeah, thank you, Mr. Chairman. It's under local government response, and there are a few other of the smaller school districts that have listed individual responses in that document.
There we go. Thank you. Appreciate that. Do any of the committee members have any other questions on Senate Bill 194? All right, thank you. Is there anyone else that is here today on the Zoom that has anything to present on Senate Bill 194? That's it? Okay, thank you. All right, so we can go to the phones and see if we have anybody that's called in support of Senate Bill 194.
Thank you, Chair Brooks. To testify in support on Senate Bill 194, please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Do we have anyone in opposition to Senate Bill 194?
Thank you, Chair. To testify in opposition on Senate Bill 194, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
And do we have anyone in neutral?
Thank you, Chair. To testify in neutral on Senate Bill 194, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. We had a note from NSHE that was undetermined. Do we have anyone from NSHE that can address that on the line or on the Zoom?
Yes, Chair Brooks, this is Chris Gow with the Nevada System of Higher Education. And the original bill required agreements with NSHE institutions to grant credit for the state seal in civics. The amendment removed this section of the bill, and therefore there is now no fiscal impact on NSHE institutions, and we withdraw our fiscal impact.
Thank you. All right, I think that's it then. I don't, unless the committee has any other questions, I think that's it. So thank you, sir, and we can close this hearing on Senate Bill 194, and we can now go to open up a hearing on Senate Bill 76. And Senate Bill 76, Mr. Thorley, if you want to give us a description of the fiscal issues.
Thank you, Mr. Chair. Wayne Thorley again for the record, LCB Fiscal Analysis Division. Senate Bill 76 is a Department of Education bill. As amended, the bill will seeks to remove the requirement that the State Board of Education adopt a regulation identifying which courses require an end-of-course examination. Those of you that sit on the Education Subcommittee may recall earlier in the week during budget closing, there was a discussion on the Department of Education's budget and the recommendation to eliminate the funding for end-of-course examinations in the Department of Education's budget. The recommendation from the subcommittee was to adopt that recommendation to eliminate funding, which is consistent with the amendatory language in Senate Bill 76, removing that provision requiring the State Board of Education to identify which courses require end-of-course exams.
Thank you, Mr. Thorley. And I think we have the Department of Education who can address that. And I think, Ms. Nick, you back up.
Thank you, Chair Brooks, Vice Chair Dennis, members of the Senate Committee on Finance. This is Sarah Nick for the record of the Department of Education, analyst to the State Superintendent of Public Instruction. As Mr. Thornley mentioned, Senate Bill 76, as amended, repeals NRS 390.700, which did require the State Board of Education to adopt regulations to prescribe end-of-course exams, or known as our districts as EOCs. As we heard earlier this week in the Education Subcommittee, funding for end-of-course examinations has been removed from the Department of Education base budget, which is consistent with Senate Bill 76. The recommendation of the subcommittee was to approve the elimination of funding, and I'm available for any questions you may have at this time.
Thank you. And so that completely removes that fiscal note as amended. Well, there was none, and we're just confirming that there is no fiscal impact. Okay, great. Does the committee have any questions for Ms. Nick on Senate Bill 76? Senator Kiefer?
Thank you, Mr. Chairman. So, Ms. Nick, we also decided to restore or continue funding external evaluations for some of our programs. I know that there are some amendments to the provisions of those programs in this bill. It looks like it's being amended to say that to the extent that money is available, those evaluations will take place. And so I would assume that based on the actions of the subcommittee that money will be available and those external evaluations for those programs will continue.
Thank you, Senator Kiefer. Chair Brooks, through you to Senator Kiefer. This is Sarah Nick for the record of the Nevada Department of Education. Senator Kiefer, you are correct. At the end of the bill, I'm looking at, let's see, Section 52, where several of the services provided have been amended that to the extent money is available, services will be evaluated for such student groups such as early literacy services and at-risk students who may have been formerly served by our Zoom and Victory School programs. But of course, as money is available, we've amended this bill so that those services would be evaluated on a rotating basis, and that the evaluators would evaluate such programs within the school year. So the evaluation cycle is reflective upon when these evaluators could best evaluate programs without putting an unnecessary burden on our school districts.
Thank you, Senator. Any other questions? All right, thank you. So with no other questions, we'll go to the phones and see if we have anybody on the line in support of Senate Bill 76.
Thank you, Chair. To testify in support on Senate Bill 76, please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Do we have anyone in opposition to Senate Bill 76?
Thank you, Chair. To testify in opposition on Senate Bill 76, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 577. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Chris Bailey, Nevada State Education Association. NSEA is proposing an amendment to SB 76 as amended to keep 4 NSEA nominations to the Teachers and Leaders Council. I realize this is a money committee, but this is the first opportunity for us to weigh in with this amendment language. NSEA has been an active participant with the TLC since its formation, nominating 4 public school teachers to the TLC to provide geographic diversity of schools, school districts in the state. The Teachers and Leaders Council makes recommendations concerning the statewide performance evaluation system to ensure educator evaluations are fair, timely, rigorous, and valid. Included in an amendment to SB 76 adopted by the Senate Committee on Education with language reducing NSEA's nominations to 3. This amendment would compromise NSCA's ability to provide geographic diversity, so we are submitting amendment language to keep NSCA's fourth nomination to the TLC. Thank you.
Chair, there are no more callers in opposition at this time.
Thank you. Do we have anyone in the neutral position on Senate Bill 76?
Thank you, Chair. To testify in neutral on Senate Bill 76, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. If the committee doesn't have any further questions, we will close the hearing on Senate Bill 76, and we will open up the hearing on Senate Bill 40. And this is a Committee on Health and Human Services bill on behalf of the Patient Protection Commission. And it provides for the collection of certain data relating to health care. Mr. Thorley, if you could describe the issues for us, please.
Thank you, Mr. Chair. Good morning, everybody. Again, Wayne Thorley for the record, LCB Fiscal Analysis Division. As introduced, the Department of Health Care, Division of Healthcare Financing and Policy submitted a fiscal note on the bill. The bill has since been amended. The Senate adopted Amendment 175 to Senate Bill 40. Recently, the Division of Healthcare Financing and Policy submitted an unsolicited fiscal note on the first reprint version of the bill. That unsolicited fiscal note is up on Nellis. While still showing a fiscal impact to the division, the dollar amount has changed based on the amended language of Senate Bill 40. The Public Employees Benefit Program also submitted a fiscal note on the bill as introduced, indicating an unknown fiscal impact, but also identified approximately $100,000 impact for developing a database with the vendors. And those were the fiscal notes submitted on this bill, Mr. Chair.
Thank you. And I am looking at the amended, the unsolicited fiscal note from Department of Health and Human Services based on the amended amount. And so am I looking at this correctly? And if we have anyone from Health and Human Services that can answer this. So the original fiscal note total effect in the biennium was 7.2 million, and the amended is 6.94 million in the biennium. Is that correct?
Hi, Sandy Rubelig for the record. I'm with the Department of Health and Human Services. I do have Ellen Crecilius on the line who can speak to the dollar amount on the fiscal note.
Ellen Crecilius, actuarial economist for Nevada Medicaid. For the FY 22-23 biennium, the total fiscal note should be $4.4 million. And the change between the prior version and this version is that the timing of some of the items changed. And also there was an additional contract for RFP assistance added. This sort of RFP is very complicated, and relying on some of the experts in the field to help us be sure that our RFP is appropriately set up is really important. And so we did add a contract for that.
Thank you. Did you have a question, Senator Ratty?
I did. Thank you so much for the opportunity. So I was trying to make my way through the unsolicited fiscal note to understand. So that is the big dollar amount for the entire project. But my understanding, trying to read through it, is that some of the components of the project are eligible for a 90-10 Medicaid match. So 90% of that would be federal dollars and 10% of that would be general fund dollars. Some of the components of the project are eligible for a 75-25 match, so 75% would be federal, 25% would be general fund, and some are 50-50. And I never could get to a total general fund impact on this particular fiscal note because of all of those levels of FMAP. So do we have a bottom line general fund dollar number yet of what this would be in this biennium as opposed to a total project cost?
Ellen Crisilius for the record. So to come up with the state general fund estimate, we need to make a little bit of an assumption based on what percent of the all payer claim database system costs could be attributed to Medicaid. Because the portion that, for the ongoing operations, the portion that can be attributed to Medicaid would have a match, but the other piece wouldn't. And so we assumed that 81% of that could be attributed to Medicaid. So when we use that in our calculations, the state general fund impact we're getting is $500,000 for the biennium.
Thank you, I appreciate that. That makes 4 point something sound a lot better.
Thank you, Senator Ratty. And I jumped the gun a little bit, and it would probably be very helpful to the committee to have the Patient Protection Commission tell us about this bill before he jumped right into the fiscal note. And so if you want to go ahead.
Thank you, Chair Brooks, members of the committee. My name is Sarah Shulhagian, and I serve as the Executive Director for Nevada's Patient Protection Commission. Thank you so much for the opportunity to come before you today to present Senate Bill 40, which originated by request of the Commission as one of their priority bill draft requests for this session. As indicated by Mr. Thorley earlier, the Senate has adopted an amendment, and there is an updated fiscal note that has been submitted by DHCFP. If I can, I'm just going to give you a brief overview of the bill, and then I'll turn my time back over to Chief IT Manager Sandy Rubelit, who can speak further on the fiscal note. So the goal of the measure is to allow for the monitoring of the healthcare industry through the collection of data and reports regarding price consolidation and access to care, aimed to allow for more informed decision-making, as you cannot improve what you can't measure. One of the main provisions of this bill that will help facilitate the collection of data is a requirement for DHHS to establish an all-payer claims database. This state database will include medical, pharmacy, and dental claims collected from private and public payers. I'm available for any questions you may have, but I'll now defer to Ms. Rubelit, who can speak to the sections of the bill relating to this requirement and the further reasons for their fiscal note.
Thank you, Sarah. Chairman and committee, my name is Sandy Rubelit. I'm the Chief IT Manager for the Department of Health and Human Services. If you would like, I could go over a high level of the differences between the unsolicited fiscal note and the original fiscal note. As Ellen said, we did add expenditures for a contractor to assist with the development of an RFP to help with the vendor selection. That expenditure is eligible for 90% federal funding. We also shifted, based on knowing more about grant opportunities and what a more realistic schedule might be for implementation, we did shift expenditures. We are going to apply for the No Surprises Act grant, which does make $2.5 million available to states over a period of 3 years. So we are looking forward to that application being open for us to apply for. We shifted the staffing to begin January, excuse me, of 2022 based on the project start and implementation. We shifted the data analytics economists and biostatistician positions to begin later based on the project timeline. And we also shifted ongoing operation costs so that it would be in line with what we hope to be our go live date of January 1st of 2023. And I'm happy to answer any questions about the funding. As with Medicaid and federal match, it's really straightforward and not complicated at all. So.
I hope you can. Senator Ratty, you have a question?
Thank you, and thank you, Ms. Rubelit, for bringing up the grant. I love the name of this grant, the No Surprises Grant, but we don't know if we're going to get it yet. So can you tell me, with that grant process, my understanding with that grant process is it compared to most grants, it is a bit of a given. States across the nation are setting up these all-payers claims databases. And so can you just talk about your expectations about that grant, and if that grant would cover the 500,000 remaining fiscal note that we were just talking about earlier?
Sure. So what we know today is nothing is quite laid out. We do know that all states have an amount allocated to them. So it's what's considered a non-competitive grant. So there is $2.5 million set aside for each state to either implement a new APCD or improve upon one that exists. So we are hopeful. We originally had planned, assumed that implementation would be around $2 million based on what other states have experienced. But based on the fact that the grant is available to us and is for 2.5 million, we are hopeful that we can stretch that and get the most out of the grant dollars. Last we heard, the application process should be released around June. We're thinking that the application would be able to be submitted in the fall. And hopefully we would know if we were awarded the grant, which again, we feel like as long as we put in a good application that we will be awarded the grant, and we're guessing it would be around January timeframe. So I hope.
And just as follow-up, is it your expectation then that can be used to do the federal match? It's a grant from the federal government to do programs that have federal match requirements, so I'm just curious about how that might work.
Thank you, Senator Ratty, for the question. You actually can't match federal grant dollars to federal dollars. So that's why there is a state general impact. So I'll try to explain. The Medicaid Enterprise Systems funding is the funding stream that Medicaid uses for their systems. And so that's where the 90-10 match comes in. The 10 has to come from a state source. It has to be non-federal. So to the extent that we cost allocate any portion of this to Medicaid, those are the rules there. So we're hopeful that the grant will cover the implementation 100%. And then anything outside of the planning we're leveraging 90-10 funding under Medicaid Enterprise Systems. We then hope to use the grant funding for the implementation. And then when we move into operations, we again would use the Medicaid funding, which at that point becomes 75-25, but we can only use a portion that can be attributed to the Medicaid population. So we, simple math did, an 81% number of the population would be attributed to Medicaid. The remainder would have to be state general fund. Hopefully that makes sense.
I think if I can say that back, maybe without putting the dollar amounts, I think what I heard you said is that we're relatively confident we'll get the grant and that will cover most of the startup costs. And there's some portion of that beginning phase that is the 90-10 match that we will need some portion of general fund for. And then in future biennium, because this system isn't going to be, by the timing of this is about that the system gets stood up about the next time we're going into our next biennium. So then you start talking about future ongoing operating costs, it would be a 75-25 match.
Correct, for the portion of the operating costs that can be attributed to Medicaid.
Great. Understanding the complexity of this particular funding stream in this particular project, anything we can do to get it very tightly dialed down to what that upfront cost is that will be on the general fund, which it sounds like is $500K, we would really appreciate. Thank you.
Thank you.
Thank you, Senator. Anyone else have any questions? You? Senator Keukefer?
Thank you, Mr. Chairman. I'm trying to figure out how you land on an 81% number attributable to Medicaid. That's a lot more than we actually insure through that program. If there's 800,000 lives insured by Medicaid right now, that's not 81% of the total insured population. So can you tell me how you landed on that number?
Sure. Thank you, Senator Keukefer, for the question. Sandy Rubelid, Chief IT Manager, for the record. We discussed with our federal partners options on cost allocation plans, and what we landed on, which still needs to be formally approved, is that not all plans are required to participate in the APCD. So what we looked at was what is the number of insureds for the mandatory participation population. We took that number and then did some number crunching and came up with, Medicaid's portion of that is around 81%. And so CMS agrees that that's a logical method we wouldn't be funding anyone from the ERISA plans to be participating because they're voluntary. Should that change later, we will have to update our cost allocation plan, but we're making assumptions now that it would be limited to the the mandatory population.
I'm sorry, I thought the mandatory population was all commercial insurance too. I thought it was everyone regulated by the Division of Insurance.
Thank you for the question, Sandy Rubeloid. Make up in Nevada, roughly 48%. And then we have, the uninsured population. So that leaves you with the mandatory population number that we used was just under 1 million total. So it was 992,000. So, and that would include Medicaid, checkup, public employees, and then the small group plans. And we can certainly get those calculations refined and sent over if it would be helpful.
I'd be curious to see them. If 80%, more than 80% of the data that's going to be inputted into the all-payer claims database is going to be out of Medicaid, then I'm wondering what we're going to get out of it from an informational perspective. We already have that data. Thank you, Mr. Chairman.
Senator Ratty?
Thank you. And I think we really probably should address that question. So it's Medicaid, PEB, private insurers, small business plans. I think right now we have no line of sight at all into anything that isn't a public program. And so through the mandated employers, though they are a smaller part of the population, they are going to give us a significant insight to how claims are being handled anywhere outside of a public program. And we have zero line of sight to that at this point in time. But Ms. Rubeloid, can you answer that question? Or Ms. Colhagen, whoever is the most appropriate.
Sarah, do you want to? I also have Carmen on the line that might be able to help with
actually,
any.
Ms. Morgan would be great because she's the statistician. That would be great.
Thank you.
So I think this is Kyra Morgan for the record, the state biostatistician for the Department of Health and Human Services. I just want to make sure I understand the question, which is if our assumption is that 81% of the population in the all-payer claims database comes from Medicaid and we already have those claims, what's the value add? I think is that the question first? Okay, so I think there's a couple key points. One is exactly what Senator Ratty mentioned. We have absolutely no insight into that other proportion of insured people. So a lot of the work that we want to do around transparency and just appropriate, making sure that things are costed appropriately across different payer sources, we have absolutely no visibility into that. So even if the claims for those other sources only make up a small proportion of the total universe of claims, it still provides a lot of insight into the actual data and how those claims are being adjudicated and things like that. The other thing I would mention is just that even though those other payers aren't mandated to submit data into the all-payer claims database, I believe this is a really important first step in getting something established so that eventually, hopefully, some of those plans will kind of voluntarily submit their data. It is written into the bill that we will not provide data back to groups that are not submitting data into the all-payer claims database, so they won't have the advantage of the analytics that we are able to provide unless they choose to participate. And so I think that the first benefit is just giving that visibility, even if it is only 10%. It would be potentially 100% of those particular payers, which would give the full picture for that universe of how claims are adjudicated and what healthcare costs are for that population. And then secondly, really, I think this is paving the way for additional payers to want to participate in an all-payer claims database because it would promote voluntary participation, and then we would be able to assist them with some analytics that maybe they would be interested in requesting from the team that they don't have the ability to get currently.
Thank you. So what would, if they voluntarily participated and I'm not sure exactly who can answer this, but if they voluntarily participated, and would there be a cost allocation, would that change the cost allocation formula? And is that just going to be strictly based on numbers of covered individuals in the state?
Thank you, Senator Brooks, for the question. Sandy Rubelid for the record. Cost allocation plans are agreements between us and CMS, and they are generally updated on an annual basis. So we would start out with the 81% with what we know. As we get voluntary plans submitting, we would then have to adjust those numbers because the Medicaid program is funded, partially federal, partially state, and the federal government wants to ensure that they're not paying for the Medicaid population data being transmitted, costs associated, that sort of thing. So it would adjust the cost allocation plan, but it's kind of a fluid number. And at this time, it really is just an estimate. It's based on what we know today.
Thank you. Before I start pulling on threads on any further, I'm going to stop there. But so I just need to walk through, in my mind, kind of the timeline. So there's an application for a grant. It's highly likely that that is approved, and then would no monies be spent until that grant approval process came in. And then when you did start spending the money on standing it up, could you just, and I know you've said it twice, but we can say it for a third time, what is your estimate on what the general fund impact would be?
Thank you, Senator Brooks, for the question. Sandy Rubelid for the record. So the high-level timeline, as we know things today, which is subject to change, is we would start the planning and procurement assistance contract October 1st. We would hope to release an RFP in parallel with our grant application so that once we were allocated the funds, we could then hit the ground running, sign the contracts with the awarded vendor, and get moving on the project. The timeline does take into consideration a 12-month implementation project. So starting, we would hope to get the grant award by January of 22. We would start the project hopefully at that same time if everything lines up, and then have a 12-month implementation period, and then roll into operations as of January of 23. And that's if all planets align. So.
But everything is contingent upon the award of the grant. Is that correct?
Correct.
And then the last piece of that, the general fund portion after this calculation that you've spelled out for us here, is around $500,000 in the biennium.
Sorry. Thank you, Senator Brooks. So for this fiscal note, that is the calculation. What I can say is based on other states' experience, ongoing operations of an APCD is around $3 million per year. So that would include technology, staffing, all of those things. That amount would need state general fund support, and the Medicaid program can draw down 75% federal funding for the percent of the total of operations that can be attributed to the Medicaid recipient base. So it's hard to calculate that number today. I don't know if Ellen wants to jump in as our actuarial economist. It's better at math than me, but that's generally the idea, is that the $3 million would have to be attributed and cost allocated to Medicaid based on the Medicaid population. That piece could be 75% federally funded. The rest is state general fund. What cannot be contributed or cost allocated to the Medicaid population would be 100% state general fund.
So on the ongoing operating costs of roughly $3 million a year based on, other states' experience, and 81% of that population is Medicaid, and 75-25 match on that 81% of the 30 million. Did I get that correct?
Yes, you did. Very good.
Excuse me, Senator Ratty, what was that?
I think he said 30 million, it's 3 million.
Oh, yes, I'm sorry. Throwing zeros and commas around today. All right, thank you. I think I finally understand. Does anyone on the committee have any other questions? Senator Kiefer?
Thank you, Mr. Chairman. And shifting gears a little bit, I see Ms. Rich is on the Zoom, and PEB had a sort of potential fiscal note as a potential submitter of information. I thought maybe it would be worthwhile to hear her perspective.
Absolutely, thank you. Ms. Rich, could you walk us through your take on this as a submitter?
Sure. For the record, Laura Rich, I apologize. I was actually testifying at a different hearing, so I had to jump in the middle of this one. PEB originally did place a $100,000 fiscal note on this bill as a precautionary measure. We didn't know how much it would really take for PEB to be able to provide the claims information to this all payers database. And it just depends on the reporting requirement. And after some discussions with both Ms. Rubelit and some of the other players in this, their stakeholders, I believe that we're pretty safe to say that we can probably take this fiscal note off. Providing a very standard claims dump, PEB can do that very easily. Our vendors are well equipped to be able to do that. It's when we start placing more requirements and it starts getting more complex, and we've got to change the data fields and things like that it starts coming at a cost. So I think as long as there's some sort of standardization, which it sounds like there is, and the state of Nevada is not the first, obviously not the first state that has done this, and so there's already some sort of standardization as to how the claims reporting is being accomplished. So I think that moving forward, we do not anticipate this to come at a cost to PEB in the future.
Thank you. Do we have any other questions from the committee? All right, I appreciate it. Thank you very much. We will then go to support and opposition and neutral, and we'll is there anyone in the room that I think everyone, there's no public in the room today to testify in this. We can go to the phones.
Thank you, Chair. To testify in support. Thank you, Chair. To testify in support on Senate Bill 40, please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Can we see if we have anyone in opposition to Senate Bill 40?
Certainly, thank you. Certainly, thank you, Chair. To testify in opposition on Senate Bill 40, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
And do we have anyone in neutral?
Thank you, Chair. To testify in neutral on Senate Bill 40, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
All right, thank you. So that will bring our hearing on Senate Bill 40 to an end. I appreciate everyone that presented this and put so much work into it today. And we will move on to Senate Bill 70. And that is, we'll open the hearing on Senate Bill 70. And that is from the Committee on Health and Human Services on behalf of the Northern Regional Behavioral Health Policy Board. And we could, Mr. Thorley, if you could present the fiscal issues associated with this bill before we have the presenters go.
Thank you, Mr. Chair. Again, for the record, Wayne Thorley, LCB Fiscal Analysis Division. As the chair mentioned, Senate Bill 70 revises provisions related to mental health. The Fiscal Analysis Division did reach out to several state agencies requesting fiscal notes on the bill as introduced. The responses are on Nellis. As introduced, the Division of Public and Behavioral Health within the Department of Health and Human Services did submit a fiscal note of approximately $19 million in the upcoming biennium. However, I will note that the Senate has adopted an amendment to the bill, Amendment 51. The Division of Public and Behavioral Health has submitted an unsolicited fiscal note on the amended version of the bill that is also posted on Nellis. The updated fiscal note from DPBH indicates no fiscal impact. Lastly, I'd note that as introduced, the Department of Public Safety in their fiscal note response did note that the impact to the Department of Public Safety cannot be determined. And I believe Ms. Flood is here to present the bill.
Thank you, Mr. Thorley. Ms. Flood, will you go ahead?
Yes, thank you. Good morning, Chair Brooks and members of the community. I'm Jessica Flood, and I'm Regional Behavioral Health Coordinator for the Northern Regional Behavioral Health Policy Board. SB 70 is focused on clarifying and modernizing the involuntary mental health detainment and treatment laws in NRS 433A. We did not intend for this bill to have a fiscal impact. However, the Division of Public and Behavioral Health identified potential unanticipated service burden. We worked with them to develop an amendment that addressed their concerns. And as Mr. Thorley said, they determined that it won't have a fiscal impact on them. So they submitted an unsolicited fiscal note earlier this week. And I'm happy to provide other information if you need it.
Thank you. Do any of the committee members have any questions on Senate Bill 70 for Ms. Flood? Thank you. I think that was the simplest hearing we've had yet, so I appreciate that. So I'll go and see if we have anyone on the phone in support of Senate Bill 70.
Thank you, Chair. To testify in support on Senate Bill 70, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 982, please press star 6 to unmute. Thank you, caller with the last 3 digits, 982. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
My name is Robin Reedy, R-E-E-D as in dog Y. I'm the Executive Director of NAMI Nevada. I'd like to speak to members of the committee on behalf of NAMI Nevada and offer our support on SB 70. Hopefully I'll be as quick as Jessica. Given the impact these illnesses can have on individuals, their families, our community, NAMI believes having updated and understandable language will aid in having consistent practice and implementation throughout Nevada. Early intervention saves lives and money. And of course, there's no dollar amount that you can assign to a life lost to the ravages of serious mental illness. Thank you for your time, and please support SB 70.
We are currently in support testimony on Senate Bill 70. If you have recently joined the call and would like to testify in support, please press star 9 now to take your place in the queue. Chair, there are no additional callers in support at this time.
Do we have anyone in opposition to Senate Bill 70?
Thank you, Chair. To testify in opposition on Senate Bill 70, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Do we have anyone in a neutral on Senate Bill 70?
Thank you, Chair. To testify in neutral on Senate Bill 70, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 961. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning. This is Christina Brooks, BROOKS, Agency Manager, and I am here to testify on behalf of DPBH. We'd like to thank everyone that worked on this bill. And DPBH is neutral on SB 70 with the reprint that removes the fiscal note due to Section 11 that allows for other programs to provide assistant outpatient treatment. Section 18 that states the assisted outpatient treatment program must be available in the county that the person resides and that the person who petitions the individual into the program must provide the service. And Section 47 that does not require hospitals to practice conditional release and therefore removes the fiscal note. Thank you.
We are currently on neutral testimony on Senate Bill 70. If you have recently joined the call and would like to testify in neutral, please press star 9 now to take your place in the queue. Chair, there are no additional callers in neutral at this time.
Thank you. That'll bring our hearing on Senate Bill 70 to an end. Thank you, Ms. Flood. And we'll close this hearing on Senate Bill 70 and open up a hearing on Senate Bill 154. Senate Bill 154 is from the Senate Committee on Health and Human Services on behalf of the Legislative Committee on Healthcare. Makes changes related to Medicaid coverage of certain treatments administered at institutions for mental diseases. Mr. Thorley, could you introduce the issues on this bill?
Thank you, Mr. Chair. Again, for the record, Wayne Thorley, LCB Fiscal Analysis Division. The Division of Healthcare Financing and Policy did submit a fiscal note on the bill as introduced. The Senate has adopted an amendment, Amendment 94, to Senate Bill 554. Fiscal staff has reached out to the Division of Healthcare Financing and Policy to inquire whether the amendatory language altered or removed the fiscal impact. And the division has indicated that the fiscal impact statement that they submitted on the bill as introduced remains.
Thank you. And if we have anyone from the agency that wants to address that or just kind of walk us briefly through the bill and then talk about, as amended, and talk about the fiscal note associated with it. Senator Ratty?
So I've got the basic walkthrough piece. I'm wondering with the COVID protocols and the challenges, do you want me to go down there or would it make more sense for me to stay here? I know that's not how we normally do things, but
We're not really doing things normal right now anyway, so I think that you could stay there if you feel comfortable with that, because we have you on camera, so I think that's all we really need to make sure happens.
okay. So I do have the fiscal overview, and then we have Senator Julia Ratty, for the record, representing the Senate Committee on Health and Human Services. I do have a fiscal overview, and then I have Dwayne Young here from the Division of Healthcare Financing and Policy to do a much more detailed analysis, because once again, this is a Medicaid analysis to get to this point. But at the highest level, what this bill does is it addresses what are known as institutions for mental disease. And so in the current federal law, the IMD exclusion prohibits institutions for mental disease from drawing down any federal match. An institution for mental disease is a psychiatric or behavioral health facility that has 16 or more beds. Attached, or as an exhibit, there is a one-pager trying to explain this for you all that I think is particularly helpful, but the bottom line is, if you go back to a time in our prior history where the concern was that there were too many people who were suffering from behavioral health disorders sitting in institutions, the response was, all right, we're not going to fund any institution that has more than 16 beds, trying to get it down to a more community-based response. And that was very effective in getting people out of institutions. Unfortunately, it was less effective in terms of making sure that people still got care. And so what is happening is, because you cannot make it makes it very difficult to make one of these agencies that either address seriously mentally ill or people with substance use disorders pencil, because 16 beds makes that very difficult to pencil. What happens is individuals with substance use disorders and individuals with serious mental illness end up instead in hospitals, in emergency rooms, inpatient beds that have a much higher cost on the one hand, and also are not providing appropriate care. So Medicaid has set up a waiver application where states can apply to the CMS and ask for a waiver from the IMD exclusion rule, which prohibits that federal match dollars for these agencies. And in that waiver process, it is required that we demonstrate as a state that there will be cost savings over a 5-year period. So this is a sequential process. The first step is the approval of this bill that basically directs the agency to apply for the waiver. The second step is that the state applies for the waiver. The third step is that CMS reviews and says, yes, we agree with you that there will be cost savings and this will be cost neutral, and therefore Nevada, you now have permission to draw down federal match for these types of institutions, which then ends up in a benefit, not just on a financial issue in that we we reduce the number of people who end up in much higher cost locations for care, which helps the Medicaid budget, right? If you're don't have people in an emergency room setting or taking up a bed in a hospital that has a higher cost, and instead have them in these facilities where they're getting appropriate care, perhaps at a lower cost, then that solves two problems. A, that individual gets a much better and more appropriate level of care, and B, it saves the Medicaid system money. So they did a very complex analysis to get to those numbers that I am not going to try to explain, but would prefer to turn it over to Dwayne Young from the Division of Healthcare Financing and Policy.
Thank you, Senator Ratty. Mr. Young?
Good afternoon, Chair Brooks, Senator Ratty, and the committee. Thank you. Senator Ratty has done an excellent job of explaining this. And so I'll start a little bit in layman's terms, and then I have with me our actuarial economist, Ellen Crecilius, if there's greater detail needed by the committee. To estimate this fiscal note, we realize that there are some upfront costs, as Senator Ratty has mentioned. That is the development of the waiver. And so we have contract support to help us budget that budget neutrality piece, as well as some system changes. But what we've estimated is that within the biennium, while we must have budget neutrality over the life of the entire waiver, which is 5 years, within the biennium, those costs can be neutralized, as well as bringing some savings to the state, just by estimating that if 50% of the individuals that we're currently treating in facilities that get around the IMD exclusion rule were to actually be treated in IMDs or other facilities that we don't typically consider IMDs, such as for the treatment of substance use disorder, if at least 50% of this population were treated in those facilities, which we know would likely be greater, but for stigma, some may not, then the state would see an immediate savings within the current biennium, enough to pay for the cost of putting together the waiver and lifting it up within the first year of the biennium, and of course would meet the CMS requirements for budget neutrality over the life of the waiver for 5 years.
Thank you. And before I turn it over to the committee, I have a question on the initial funding to stand up the program. Is that funding limited in where it can come from? Since it's essentially going to be federal matching, a lot of federal matching dollars moving forward. Can that money be from any federal dollars? Is there a prohibition on that being federal dollars? Does it have to be general fund dollars? Could it even be settlement dollars?
Again, Dwayne Young, Deputy Administrator for the Division of Healthcare Financing Policy, for the record. Chair Brooks, that's an excellent question. And those funds, because they will receive Medicaid match, even the waiver development and the contract services will receive federal match, must come from state general fund. And so what you'll see presented in our note is that there are some costs out of Medicaid budget account for admin. And so those costs, and so what the division is really asking is that the savings that we will see in the medical budget then be allowed to be pushed over to our admin budget to cover those costs within the same biennium.
Thank you. Appreciate that. Do any of the committee members have any questions for Mr. Young or for Senator Ratty? Senator Ratty, you have a question for Senator Ratty?
No, I just want to help to answer that question and just go back to Mr. Young to clarify. So you said it had to be state general funds, but I actually think the question is, does it have to be general fund, or could it be settlement dollars or another source of funds as long as that is not federal dollars?
Dwayne Young, for the record, yes, that is correct. It can be any source of funds that are not federal funds, and yes, settlement funds are often used for match.
Thank you. I think that's the clarification, and I'm not asking a question. I'm just helping to answer the question. All right, that's all I had.
Thank you, Senator Ratty, for helping me ask the question that I was asking and never quite finished asking, so I appreciate that. Do any of the committee members, Senator Sievers, answer?
Thank you, Chair Brooks. So these waiver opportunities seem to pop up. This sounds really great, and so I want to know if other states are doing this. And it seems like it's ever evolving, that another state will lead the way, and then we'll discover it, and we realize that we can do more things for our citizens, but we have to be aware of them and again, go through the waiver process. So are other states doing this?
Dwayne Young for the Division of Healthcare Financing and Policy. Approximately about 40 states are implementing some form of waiver. CMS has asked states to implement the waiver for substance use disorder first, and then they are using those development processes to help states submit their waivers for serious mental illness waivers. But yes, to answer your question, approximately about 40 states are in this process.
Thank you.
Thank you. Do any committee members have any questions? Senator Kiefer?
Thank you, Mr. Chairman. Mr. Young, when the waiver is fully implemented, aside from the healthcare benefits for our clients, how much do you anticipate savings to be on an annual basis by the shift away from ERs and into IMDs?
Dwayne Young for the record. So I'll start, and I may hand this over to Ms. Crecilius. So I can't give you a number for future years, but what I can say is, in the current process, people are presenting in emergency rooms and then being treated. The only place they can be treated is in an acute hospital, and if they end up in an IMD, if they're on the MCO side, the MCOs have a rule called in lieu of, which means they can pay for approximately 15 days each month of inpatient treatment in lieu of more expensive treatment. And so that's the threshold, and we find that individuals have to be moved out in those 15 days and then tend to cycle back longer. So if they could actually be treated longer, it would be a longer term cost to the savings. The most immediate cost is those IMDs, because they are cost-based in their reimbursement calculations and methodology. They are, by standard, much cheaper than acute hospitals. So for every person that we shift out of the treatment in an acute hospital, whether they're in the emergency room or they are admitted, is the savings to the state, and would be a savings in the state in each subsequent year. And so I think it's one of those things that, 5 years later, we'll see it as not so much a savings, but we'll have to be reflective of all of the years of what we spent previously in not being able to treat these individuals with the proper level of care.
Thank you, Senator. And do any of the committee members have any further questions? All right, thank you, Mr. Young. I appreciate that. And Senator Ratty, thank you for presenting this. And We will then move to the phones and see if we have anyone in support of Senate Bill 154, please. Oh.
Thank you, Chair.
Hold on real quick, please, broadcast. We actually have a person, a live human being, and that is going to give some support testimony.
Let's see if I remember how to do this. Good morning, Mr. Chair, members of the committee. Jeanette Beltz on behalf of the Nevada Psychiatric Association. I didn't intend on testifying, but am here in total support, and I wanted to thank the committee for considering what looks to be a little bit of a leap of faith, but it really isn't, because ultimately those dollars are justified in savings in the long run, and appreciate very much Mr. Young's comments about being able to shift the burden from the administrative to the medical and then reflect the savings there. This is going to not only save money over the long run, but also increase quality of care that's currently being provided. So thank you so much for considering this bill, and to Senator Ratty for our champion.
Thank you, Ms. Bells. Good to see you in real life. Appreciate that. And so I don't see any other people in the audience that are going to give any testimony. So we will go to the phones and see if we have anyone in support, please.
Thank you, Chair. To testify in support on Senate Bill 154, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 982. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
This is Robin Reedy, R-E-E-D as in dog, Y, from NAMI, Nevada, the National Alliance on Mental Illness here in Nevada. NAMI Nevada believes that SB 154 will allow people with mental illness access to a full range of treatment options. The fact is that paying for treatment early on, providing services early on in the diagnosis of mental health conditions will save many and money across the board in later years. Pay now or pay later. We've tried the pay later. The pay later part isn't working. Sadly, we know what happens when people don't get the treatment they need when they need it. They can end up in jail or on the streets, leading to worse outcomes for the person, greater pain for their families, and a higher cost to the state and the federal government. Thank you for your support on SB 154.
We are currently in support testimony on Senate Bill 154. If you have recently joined the call and would like to testify in support, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 222. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Mr. Chairman and members of the committee. My name is Sarah Adler, Sarahadler. I join you today as a longtime member of NAMI and ditto what Robin Reedy just shared with you. And then also today as a member of Silver State Government Relations representing Vitality Unlimited and New Frontier, which are 2 rural substance use disorder treatment centers in rural Nevada. It is just on behalf of my clients and on behalf of the Nevadans suffering from substance use disorder and mental illness, this movement into the IMD waivers is a terrific thing for Nevada. It will increase access to specialized care, as Senator Ratty described, and enable us to serve Nevadans here in Nevada that really are in need of these services in order to become and return to productive citizenry. So we really appreciate the steps that the committee is taking today, and we urge you to move this forward. Thank you very much.
Once again, we are currently in support testimony on Senate Bill 154. If you have recently joined the call and would like to testify in support, please press star 9 now to take your place in the queue. Chair, there are no additional callers in support at this time.
Thank you. Could you see if we have anyone in opposition to Senate Bill 154?
Certainly. Thank you, Chair. To testify in opposition on Senate Bill 154, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. Do we have anyone on the line in neutral position on Senate Bill 154?
Thank you, Chair. To testify in neutral on Senate Bill 154, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. So I think that is it for this hearing. And so thank you, Mr. Young, and thank you, Senator Ratty. We will close the hearing on Senate Bill 154, and we will open up the hearing on our last bill this morning, which is Senate Bill 274. That is sponsored by Senator Ratty, and it revises provisions relating to commercially sexually exploited children. Senator Ratty, whenever you are ready. If you're comfortable there, that's okay with me, because we got you on the camera.
I was really asking, do you want fiscal staff to do the basic overview of the fiscal notes first?
Oh, I'm sorry. I thought you wanted to move. That would be a great idea. Mr. Thorley?
I thought I was getting out of it. Good morning again, committee. Wayne Thorley for the record, LCB Fiscal Analysis Division. Regarding Senate Bill 274, the Division of Child and Family Services did submit a fiscal note on the bill as introduced, indicating a fiscal impact. However, did note in the fiscal note that it would not be a general fund impact and that federal funds are available to cover the costs associated with this bill. The Senate did adopt an amendment on Senate Bill 274, Amendment 262. Have received confirmation from DCFS after the amendatory language has been reviewed that DCFS still indicates that federal funds are available to cover the anticipated fiscal impact related to the bill. Clark and Washoe counties also submitted fiscal notes indicating a fiscal impact. The amendatory language that was adopted by the Senate does appear to alter those. Fiscal staff has been having communication with the counties, and I believe Clark County possibly is available to talk about that, but that's where we're at today on Senate Bill 274.
Thank you, Mr. Thorley. Senator Ratty, if you want to give us an overview.
Thank you, Mr. Chair. Senator Julia Ratty for the record, representing District 13. This one probably needs a little bit of context. So the policy, the policy statement in this bill is actually pretty straightforward, and that is that when we have children who are victims of sexual exploitation, meaning that basically they have been trafficked, that they should not be treated, even though there may be associated small level crimes with their participation in their own exploitation, that they should not be treated in the juvenile justice system as offenders. Rather, they should be treated in the child welfare system as victims. So that's the basic premise. I think it's a critically important policy statement. And I would say that it's a goal that both the juvenile justice system and the child welfare system has been working towards for quite some time. But because of a very specific challenge, and that challenge is that for a portion of these children, having them in a secure facility is important because of the influence of, and I'll just use the word pimp, on their lives, means that they can be a pretty significant flight risk. And so the default has been to then, if we don't have a secure child welfare system to place them in, then we need to place them in the juvenile justice system. And unfortunately, that placement in the juvenile justice system can be additionally traumatizing and sometimes re-traumatizing for these children who are truly victims and not offenders. And so in the last legislative session, there was a Senate bill, I ran a Senate bill that passed, that basically drew a line in the sand and said, we will no longer, as a state, treat children who have been trafficked as offenders. We will only treat them as victims, and they need to move into the child welfare system. And on the very surface level, one would think, well, if we're spending money on them in the juvenile justice system, then we should be able to just spend money on them in the child welfare system. But the complication is these are systems that are highly funded with restricted dollars, and you can't just say, I'm going to take the money that I was using to house them in the juvenile justice system and now house them in the child welfare system. And that is a real complication for our counties, and I recognize that while I and all of my colleagues who voted for this bill in the last legislative session very much want to move these children who have been victims and we want to become survivors into this other system, there are real costs associated with that. So the work on this bill, so starting with the last legislative session, we allocated to the Division of Child and Family Services money to hire a contractor to facilitate 2 years worth of conversations. We drew the line in the bill last session and said that by July 1 of 2022, we will no longer do this. And you have 2 years to go figure it out. There were a series of working groups over those 2 years with state government and local counties to figure it out. And we got a long ways, but the funding mechanism is still the challenge. And so the amendment, if I understand it correctly, and that's why it's important that we're going to be able to get the counties to talk to us, is that we are now, the bill does a better job of aligning the language of this bill with what are known as Title IV-E dollars for children who are in need of protection. And if we do a better job of aligning this with those dollars, then counties will have a better level of flexibility to use existing resources in a different way to serve this population. I think it's also important is the bill as originally interpreted was read as a mandate that counties had to open these receiving centers, which is the terrible name for the locked down child welfare facility, and that really isn't the intent, and that there could be other creative solutions, though receiving centers could be a solution. And we wanted to set up the framework for building the licensing and the structure around receiving centers, because nonprofits may be interested in getting in that business, or counties may be interested in heading in that direction. So my understanding is that the significant work that's gone into this bill has reduced the fiscal notes from the counties, and I believe that I thought that we had representatives from Washoe County on the Zoom, and I know that Joanna Jacob from the county is on the phone line. She was prepared to testify in neutral, and I do have the last 3 digits of her phone number, if that is helpful to call her up. But I do think it's important that okay, so Amber Howell is also on the phone. So Amber Howell representing Washoe County and Joanna Jacob representing Clark County are on the phone, and I have the last 3 digits for both of their phone numbers. And I apologize that we didn't get them into the Zoom. This committee hearing came up pretty quickly.
Yeah, thank you. And so I know that I just got a message from Ms. Jacob, and she said she can get into the Zoom if that would be helpful. I think it would be more helpful for me. Broadcast, is there anything that I need to do to facilitate that?
Thank you, Chair. Would you like me to call Ms. Howell or Ms. Jacobs that are on the telephone to speak?
Chair, if we could take a 1-minute recess, I have them on phone. I could email them the link if I can just get the link.
That's a perfect idea. Let's take a 1-minute recess, and we'll facilitate getting both of them on broadcast so that we can have them on the Zoom. Because I think that'll be very helpful, because that's kind of the crux of the issue here.
Absolutely. Thank you.
All right, I'd like to, oh, I'm going to wait a second. All right, we're back in the hearing on Senate Bill 274, and I think that we have on the line as well, we have Ms. Roos, and who could explain, maybe give us an overview before we go to Ms. Howell and Ms. Jacob.
Good morning, Chair Brooks and the Senate Finance Committee. Catherine Roos, Deputy Administrator for the Division of Child and Family Services. DCFS has submitted a fiscal note in the amount of $173,888 to hire a contractor to engage stakeholders in the development of the licensing requirements and regulations relating to receiving centers and the service provision, and to update policies and procedures relating to the oversight of the receiving centers and the services for commercially sexually exploited children. This contractor position would also provide outreach and technical assistance to potential providers and assist with the establishment of receiving centers. We have identified 2 federal funding sources, Title 4B Subpart 2 and VOCA, to fully fund the position without impacting state general funds. And those are all of the fiscal impacts identified for DCFS.
Thank you, Ms. Roos. I have a question before I turn over to the committee. And could you explain to me Title 4B dollars?
Sure. So there are several federal funding streams related to the child welfare system. Most likely you've heard of Title 4E. That's sort of the major bucket of federal funds available for child welfare. Title 4B has a Subpart 1 and a Subpart 2. Subpart 2 is specifically, and each source of funding has different eligible spending requirements, and we have identified that Title 4B Subpart 2 would be an appropriate funding source for this position.
Thank you. Do any of the committee members have any questions for Ms. Roos? All right, well, thank you. I appreciate that. And I think we'll go to Ms. Jacob, if you want to talk to us about Clark County's issues and what implementation kind of would look like.
Sure, Chair Brooks. Joanna Jacob, JOANNA-JACB, for Clark County. I'm the Government Affairs Manager for Clark County. So I will talk for, as Senator Ratty stated, we have been working with the state and other child welfare agencies on this shift that is coming from the juvenile justice system to child welfare system. They are, as Senator Ratty said, 2 different systems, and they have the child welfare system, as I'm sure this committee is very well aware, has had some funding challenges that we have spoken to in this session. So we worked with Senator Ratty on this bill to try and mitigate some of the fiscal impacts that we saw that were coming, and they were mostly associated with some of the mandates in the bill for the level of services that would have to be provided. There were also some sections of the bill that provided for an involuntary commitment process that have been deleted in the amendment because they need some additional work. The important thing to recognize here is that as Senator Ratty said in her opening comments, when you are dealing with this population, they require a higher level, or they may require a higher level of acuity for services. And Ms. Howell, if I misspeak, please let me know, because she's also the expert. I'm the representative for the Child Welfare Agency, but they require a higher acuity of services and a higher level of staffing that is associated with this shift. As we shift to the child welfare system, they will no longer be housed in a juvenile justice facility. So we will have to come up with a plan for housing. And that plan for housing really needs to contemplate being available 365 days a year, because the population is transient. And so we have estimated in our fiscal note in Clark County that we on average may see about 150 children who have been in this population, who may have been subject to commercial sexual exploitation, and that remains pretty much a constant. It is somewhat difficult to track. We have started working on this, on these services already. We do get reports into the child welfare system right now, but as Senator Ratty noted, we are heading to a major shift coming up that was contemplated in July 1st, 2022, but with Section 35 of this bill is now being shifted. And thank you to Senator Ratty for her assistance in this to July 1st, 2023. So Chair Brooks, I can talk to you about implementation, or I can go to the fiscal note that we originally filed and then how the amendment changed if you would like me to do so.
Yeah, why don't you address the fiscal note and as originally filed, but based upon the amended language that's in this reprinted bill here, and what that impact would be, and then I think we might have some questions from the committee. I know I have some on what it actually looks like in reality.
Sure. So again, Joanna Jacob for the record, the original fiscal note that you will see contemplated building a receiving center. And we did feel, as Senator Ratty said, that was a mandate. There were sections of the bill that had said, though it was permissive, that the state could, that we felt like there needed to be built, somebody would need to build it. And then we filed a fiscal note on the estimated costs and the construction of a facility. The reason why this probably needs a different facility is that this population can't be housed with some of our other, they have particular needs and they can't be housed with other children because they are it's a special group, I guess, that really contemplates a separate center. And so we based our fiscal analysis on an estimate at that time about 85, that we were trying to be reasonable with that estimate. The housing costs, when our survey from other jurisdictions, when you do a housing unit for this population, it comes with the supportive services. The total cost can range from $400 to $600 a day. So we built our housing estimate on the middle range of that, about $500 a day, which is really the secure facility, the staffing that comes with having a secure facility, and then the services that we provide in that facility, which could be mental health services and also that type of thing. Then we actually built in case management because the staffing is with a case manager and then the supervision and things like that. And then there were also costs that we put in our fiscal note associated with licensing, as Ms. Roos stated there, and Senator Ratty stated this too, there could be nonprofit providers who want to come in, and we had estimated that we may have to look at licensing facilities as well. We also had some staff training because the training to deal with this population usually involves training in forensic interviewing and very particular training on how to deal with this population. So our estimate at that time was $21.9 million for fiscal year 21, $22 million for fiscal year 22. And then of course we had effect on future biennia. The amendment that Senator Ratty, that we worked on with Senator Ratty actually does a lot for Clark County. First, it allows us some flexibility for alternative placements, which is if we're going to work on building towards a structure on a receiving center, that we are allowed to also look at some other alternative placements that we might be able to use. And that's in section 1.6 of the bill. We also removed references to detain and to lock. There are some restrictions on billing 4E for detention services. Is very similar, and Ms. Roos can probably give you information on that as well. So we provided for alternatives for that. We also looked at where we can reference language that would allow us to draw down 4B funding, and you'll see that in section 29, where we talked about, as we get reports for these reports, that if there is a case that warrants child welfare intervention, meaning they can't be safely returned to their home, then we would be able then to draw down some of the child welfare funding that could be used. So that was really our goal with the amendment. We can revise our fiscal note, and I apologize that I wasn't able to get this to the committee in time, but we think that with the amendment, these costs that we are incurring will be incurred largely in future biennia. With the shift in the bill to postpone that date. So we believe that we can file a revised fiscal note, really no fiscal impact for fiscal year 2021, no fiscal impact for 21-22. We have some preparatory tasks that it really is getting planned and prepared for this shift in 2023 in section 35 of the bill. So it would be building up our housing plan. It could be renovating some existing buildings or that type of things, training the staff so that we are ready to deploy on July 1st, 2023. And then we have revised fiscal impacts that we believe that we can file for future biennia, and we can work with Mr. Thorley and your staff on getting that revision done and to the committee.
Thank you, Ms. Jacob. And then I think maybe I'll turn it over to Ms. Howell before we turn it over to the committee for any questions. And so, Ms. Howell, if you could give me your perspective, both on the fiscal note, but really on the implementation of what this looks like. And I'm very curious about what any sort of offsets and duties and tasks, but costs associated with juvenile justice. You know, if we're moving folks from one type of a facility to another and one type of a treatment to another, if there's any kind of savings associated with that we could, understanding these are completely different streams of revenues and costs, but like just in the global sense, what that looks like from a shift.
Absolutely. Good morning, Chair Brooks. Amber Howell for the record, AMBERHOWELL. As far as the implementation, you know, we're grateful that we're going to be given some time to really get this thing launched. The preparation and the setup of the building has the most cost. That's a one-shot cost, which is nice to be able to do that. And so how we did our analysis is we compiled the positions ongoing, the one shot cost for building, and then the placement costs as Ms. Jacobs referenced. And so in the original bill, as many have mentioned, there wasn't a way to allow us to draw in Title 4E. So the amendment does help with that. I will caution that the Title 4E match that we're able to get is only 25%. That's something, and it certainly helps. So when we look at our fiscal note that we have in the system, the startup costs that we have for that section, there's about 1.4 million that can be drawn down from Title 4E. So that is a significant amount, even though it's only 25%. That helps a great deal. And then for the annual costs, we're able to charge Title 4E for positions and placement costs. And so we can offset almost $1 million with Title 4E. So we're also going to flush in all of the Title 4E offset so that we're able to reduce the fiscal note and have that true number. Historically, in the counties, what we have seen is, particularly around the juvenile justice arena, that their facility has a certain dollar amount that they have to keep the lights on and the staffing and that sort of thing. So even though these victims will be transferring from juvenile justice to the child welfare agency, it's not necessarily a savings as we would expect, because those are all flat costs for them to run their facility, 24-hour facilities. Even when census decreases, there's not a lot of savings because of all the overhead and just the continuous funding that has to occur. We want to look at the Victims of Crime Act funding that the state receives that could potentially offset that. There's a section of the Victims of a Crime Act funding that's for innovative or areas that are of high priority to the federal government, and child sex trafficking is one of those. And so, you know, I would expect that we would be able to submit those requests to the state, and that would also offset the general fund needed. So that's kind of in a nutshell what our fiscal note looks like, and that we would be revising it. I'm happy to answer any questions. We will be ready in 2023 to do this, and already having discussions about it. We've continued to be on work groups around this issue, and we already do get these reports, especially if they're children in the foster care system, because we have to screen for that. And so opening this up, I think, will bring additional victims into, you know, our agency, which we see as a good thing, that they have a place that they can land that is safe, that is not detention in nature. And so we will be prepared to do that in 2023.
Thank you. Do any of the committee members have any questions for either Ms. Howell or Ms. Jacob? Senator Kiefer?
Thank you, Mr. Chairman. For Ms. Jacob, your fiscal note calculated the ongoing cost by multiplying, 85 children at $500 a day, 365 days a year. I mean, is that what you expect, having that many kids? Because we try to transition these kids out after a couple of days, right? Get them back to their parents.
Thank you, Senator Kiefer. Joanna Jacob for the record. And I'll jump in and say, yeah, we estimated 85 kids in our original fiscal note. We've taken a look at that, and in the revised fiscal note, we still are estimating, and this is just based on what we've seen so far. We really do see about 30 to 35 kids on an ongoing basis that were in the course of a year. We do think that we can estimate, and I'm hoping to put this in our revised fiscal analysis that we'll be filing with the committee. We've given some thought. It seems that we may be able, and please understand these are estimates, but we think that we can return about 30% of the kids to their parents. And that's really, but we still must house them for a short period of time. Then we may have some kids that are from other jurisdictions that we may take a little bit longer to get them back to their original home jurisdiction. So those are the two situations that we frequently see. Then we may have some kids that cannot be returned to their homes. So that's why we did build it on a 365-day model, though, because we don't, and I think Ms. Howell has done this similarly in her analysis, and because we have to have the facility available for whenever somebody comes in. And that's really, we're hoping that it won't be, I guess we're hoping that we will be able to transition some of the kids back to their parents and maybe to their home states, because that is built into the revised estimate that we'll file it with the committee. So we had estimated about 30% of those kids that we might be able to return back to their homes and to their parents.
I appreciate it. Thank you. Thank you, Mr. Chairman.
Do any of the committee members have any questions for either Ms. Jacob or Ms. Howell? All right. I just have one question, and so, in this, either of you, I'm thinking primarily of Clark County just because that's the community that I'm the most familiar with, but what percentage of these children are citizens of another country, and what kind of challenge does that present if they, they don't have family here in this country, or they've been trafficked into this country? What percentage of that population do you think that would apply to?
So Senator Brooks, Joanna Jacob for the record. And again, I don't have that specific percentage for you, but I can see if I can get it for you and file that with our supplemental information that we will provide. The challenge, though, that is presented by that is really there is no that's where we may see that we may need to make this safe. And you'll see later in the bill, towards the end of the bill, if you want to take a look in section 29, when we get these reports, we have to make a plan for safe discharge and assessment of the needs. That may include trying to find discharge into a longer term placement, really. And that's where we will see the impact and that we may have these longer durations of stay, and then bringing in the services to support the kids that is particular to the need. So that will be a challenge. And Las Vegas, and is unfortunately, our area is unfortunately very high. We, compared to other jurisdictions, just because of our placement as in a tourism corridor, and the traffic that comes in across from Arizona and from California, we end up with a greater number of cases, I think, than in other parts of the state. Though I know Washoe County also has a significant number that then they see. So this is it's a challenge that we have been trying to plan for, and I think that I will get you those percentages if we can, but I can see that they would be a situation where we would have to find a longer term placement, housing placement and services. They'd probably be with us for a longer period of time.
Thank you. Do any committee members have any questions for either Ms. Jacob, Ms. Howell, Ms. Roos, or Senator Ratty? We do not have any. So, Senator Ratty, did you know?
If I could just make a brief closing comment, I want to express my gratitude to the Division of Child and Family Services and the folks from Washoe County and Clark County who are represented today. A lot of people have put a lot of time into trying to figure this out. One of the things I want to say is we also, as part of the process, did a assessment of across the nation to see if somebody else had figured it out, and nobody had. And so, particularly because we are Nevada, based in a hospitality-based economy with a lot of folks, honestly, who get trafficked to here and through here, given the nature of our economy, special events and everything that happens. If there's a state that's going to figure this out, I think sort of on a basic moral ethic level, it has to be us. And so at the end of the day, we may end up with an unfunded mandate to local governments, to which I am incredibly sensitive. And I'm so grateful that the counties have worked with us on to figure out how to reduce that impact. And I still think from the policy perspective, there's a line in the sand that has to be drawn, because if we don't, we will never move the needle on this, because the default is a system in juvenile justice that's already built and already paid for. And so the gratitude that I have for the people who've leaned in and tried to figure this out, despite the fact that it may cost them more money or be more difficult to do, is sincere and high. And it's an amazing group of people working on this, trying to figure it out. And I appreciate the time today to dig into it, because it's not easy.
Thank you, Senator Ratty. Well, we don't have any other questions, and so what I'll do is we'll go to and no one's in the room that wants to testify, and we'll go to the phones and see if we have anybody in support of Senate Bill 274.
Thank you, Chair. To testify in support on Senate Bill 274, please press *9 now to take your place in the queue. Chair, there are no callers in support at this time.
Thank you. Do we have anyone on the line in opposition to Senate Bill 274?
Thank you, Chair. To testify in opposition on Senate Bill 274, please press *9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. And do we have anyone in neutral on Senate Bill 274?
Thank you, Chair. To testify in neutral on Senate Bill 274, please press *9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
Thank you. That brings our hearing on Senate Bill 274 to an end, and we'll end that hearing and go on to our last agenda item, which is public comment. Will you see if we have anyone who would like to make public comment this morning?
Certainly. Thank you, Chair. We are currently on public comment. If you have recently joined the call and would like to provide public comment, please press *9 now to take your place in the queue. Chair, there are no public comment callers at this time.
All right. Well, thank you. So that is it for today, and this meeting is adjourned.